So welcome to this another seminar webinar from the Computational Society, Computational Society of Social Sciences of America. Got that completely wrong. Today we've got Ross Hammond from the Brookings Institute, who's coming to talk to us about agent-based modeling simulation in healthcare. The format for this is going to be, we're going to have half an hour of, well, almost half an hour of formal questions from me asking Ross. I'm Andy Collins, by the way. And then after that, we're going to open it up to the audience. So I'm not going to introduce Ross because I don't want to give away your thunder, right? So I'm going to actually ask that in the first question. So could you give the audience a little untechnical introduction to your background and how it relates to agent-based modeling and simulation?
Sure. So my background's in social science. I actually have an undergraduate degree in economics and a PhD in political science. But I started doing agent-based modeling very early when I was still an undergrad, actually. And for the first part of my career, I did agent-based modeling on economics and political science topics like corruption and ethnic conflict. And then later in my career, I moved into the health space. And now, in addition to my role at Brookings, where I run a research center which almost exclusively does agent-based modeling applied to many policy topics, I'm also a professor of public health at Washington University in St. Louis and teach agent-based modeling to public health students and have various formal policy advisory roles that are almost exclusively in the health domain. So they're at places like the USDA and the FDA and NIH and the National Academy of Medicine and places like that. And all of my work is about applying computational social science modeling in various ways. And I would say for the last decade, the vast majority of it has been in the health domain, although I do still do some other things.
Excellent. So cool. So maybe will be useful for the audience. So bear in mind, this audience, and especially those listening on YouTube, we don't know where they're coming from. So what would be helpful to just like give us a quick overview of, ABM in your domain?
Sure.
Who are the players, that kind of stuff?
Sure. So I think I don't need to introduce what an ABM is, though, right? That's something this okay, right. Very good. Okay, so agent-based modeling was pretty much unknown entirely in the health space 15 or 20 years ago. So its entry into this topic space is much newer than its entry into, for example, economics or political science. And it was a somewhat tumultuous entry in the sense that the dominant tool set in the health sciences has been, actually continues to be the randomized controlled trial on one side and regression analysis and related kinds of statistical techniques on the other side. And as this audience will be aware, those are both very different kinds of modes of analysis than something like an agent-based model. So whereas in economics, there exist mechanistic mathematical models of how the world works, they're just closed form equation based. So then the move to simulation is about those sets of assumptions changing. Or in other areas, in game theory is more closely related. It's the same kind of approach to the world that an agent-based model is. It just uses a different formalism. But in public health, it was a much bigger mind shift for people to embrace agent-based modeling. And in the beginning, NIH, there was a group of people at the National Institutes of Health, the NIH, who really promoted a set of loosely related tools that come from complex systems. And actually, because of the weird historical way in which this was introduced, these in the health sciences, these are called, quote, system science. That is the terminology. And what is usually meant by system science is actually agent-based modeling, but also system dynamics modeling and network analysis. Those are like the big three approaches that people use, and they're all lumped together as being system science, even though, as this group will be aware, they're actually quite different from each other. And some of them aren't simulation modeling at all, network analysis, but people think about it. And there was a big push from NIH to promote this, and a whole bunch of funding went into getting this off the ground. And it's actually really, there's been a tidal wave of work and of interest in this application of system science in the health sciences, to the point where actually it's now a core competency. If you want to be accredited as a school of public health in the United States, you have to have coursework on system science. It's one of the core competencies. And lots of policy applications have popped up using agent-based learning in health. I want to clarify before we get too deep into this conversation, this distinction that's pretty important in my field, even though it might seem arbitrary to your audience, which is there is actually pretty big difference between healthcare, which I noticed you put in the title here, and public health or population health. And what I do is mostly public health or population health. And that's actually a lot of what NIH does that uses system science also. So healthcare is, once you're sick, what do we do to treat you? But public health and population health are both about prevention, about making sure you don't get sick or you live a healthier life in the absence of disease, but also they're about changing systems and environments in ways that treat populations rather than treating individual patients, which is how we think of healthcare. So things like adding fluoride to the water to make sure that people don't get cavities, or adding nutrients to our bread that really only benefit women who may become pregnant. Those are population health treatments, or our food system is a population health treatment. And that has nothing to do with healthcare. It doesn't take place in hospitals. It doesn't involve doctors. It's a very different enterprise. And so I just want to make that distinction. And system science is less well used in healthcare, and that's not primarily what I do.
Oh, interesting. So yeah, so I will definitely make sure the YouTube title is public healthcare, not healthcare. But that actually sort of like leads into sort of like the next few questions I've got then. Yeah, but there was a report back in 1999 that sort of like, the to error is human, and that led to, within the sort of like medical domain, the healthcare domain, this massive explosion of simulation for training. Right. And so, and the Society for Simulation in Healthcare, I mean, that's just exploded over the last 20 years, but that's training simulations are obviously very different from, policy or, the simulations. I mean, have you noticed so within your domain of people, they understand simulations from a training point of view, but maybe you've had difficulties explaining to them how it works from a policy point of view? Has this occurred at all?
No, it's almost the opposite, in the sense that the primary, I would say, the most common usage of agent-based models in population health is for policy, to inform policy or interventions. It isn't commonly used as a training tool, except in the sense that it helps policymakers think out scenarios about possible futures and about possible interventions into those futures. So the way I tend to think about it is that there are really three main uses, ways that agent-based modeling is used in public health. And as your audience will be aware, there's actually dozens of ways to use agent-based models. And when I teach my class, I make sure to mention all of those. But the three that have sort of become the most common in public health, one of them is where there is a belief that the mechanisms are understood, and you can represent them in a simulation model, and then use the simulation model as a virtual laboratory to test out lots of different interventions or policies that you are considering in the real world, to see how they might play out. And particularly in health, as you'll imagine, doing real world experiments is often sort of unethical, or very time consuming or costly. And there's often a sort of urgency to act. And so agent-based modeling is seen as this great way, for example, if you're trying to contain a pandemic, to think through how you should do that rapidly. And so that's a very common usage. The other usage that people use, so I would say the next most common usage, is there's a huge body of evidence in public health about what works and what doesn't, but it's often not clear why things that work and why things that don't work. And we often even have the confusing situation where things which worked really well in Boston, somehow when someone tries to build an exact replication of that intervention in Minneapolis, it doesn't work. It doesn't replicate, and we don't know why. And so the second usage is sort of retrospective modeling of trying to go back and look at the evidence base from something like a randomized control trial that took place already and figure out what was driving its success or failure. But that's still about intervention. So the third usage, which I'm a big proponent of, but is less common in public health, is to actually use this to do what public health people would call etiology. That is to figure out, to infer mechanisms that may not be observable that are driving the status quo, that are creating something like the obesity epidemic, or by which people decide whether to start smoking cigarettes or something like this. And that's also, so you're building theory essentially at that point, and you're not looking at interventions. And that's also, there is a reasonable amount of that in public health also. But what I have not seen, but I'm very interested to hear more about from you, if time permits in this discussion, is the idea that you would use simulation training. In public health, people are trained in the simulation models as a technique, but their purpose in doing that and learning the technique really is to apply it to a policy setting.
Okay. I think some of it's the mentality changed. You know, within the medical domain, there's obviously they have whole simulation suites to train surgeons. And then once you've trained in the top guys, the surgeons in the hospital, that just trickles down. Everybody wants to be part of it, right?
Yeah.
So that's where the simulation comes in there. So you mentioned there's been successes there. I mean, in the past, there was years and years ago, there was discrete event simulation and systems dynamics. And these models didn't really kick off in the sort of like, well, I keep saying the healthcare domain, but public health domain. I don't, think so. I mean, you're suggesting now that ABM has been successful because it has had this big support behind it. But do you think there's any other factors that kick in there that really make it distinguish it from those other kind of techniques?
Well, I think some of it's that there was an early, just a historical accident, I guess, if you like, that one of the first place that agent-based modeling was applied in population health was in infectious disease control.
Right.
And there was, after 9/11, there was a lot of investment, as you'll be aware, in preparing to combat terrorism and deal with disasters of various kinds. And some of that money went to a group which was using agent-based modeling to look at things like bioterror attacks with smallpox. And so they built up this, and actually the only place in public health where there exists already, before agent-based modeling came along, a way of doing science that was about building equation-based representations of mechanisms, was in infectious disease, where there's a 100-year tradition of using differential equations to study the population dynamics of the spread of infectious disease. And so agent-based modeling was just sort of an incremental step beyond that. And then right after that work had just really matured, there was, in fact, a pandemic. As you'll recall, in 2009, 2010, there was an H1N1 flu pandemic. And agent-based modeling and the groups that NIH had funded, which were all under an umbrella called MIDAS, Models of Infectious Disease Agent Study, were pushed into the limelight and asked to actually directly advise policymakers to make real decisions about what to do in that crisis. And it was seen as hugely successful in both scientific and policy terms. And so that would then everyone was like, well, wow, let's do this all over the place. Why aren't we doing this for chronic disease? Why aren't we doing it for tobacco and obesity and nutrition and, mental illness and all these other things? And so there was just an explosion of things. Now, the reason that agent-based modeling in particular was so appealing for infectious disease is because what it allowed you to do that the equation-based models did not was really three things. The first was that it enabled you to capture massive heterogeneity that had to be averaged away in the differential equation formulation. The second was that it allowed you to incorporate real spatial structure, physical geographies and social networks of contact that also basically had to be ignored in the equation-based treatment. And the third is that it enabled you to have real endogenous adaptive behavior on the part of individuals, which also was more awkward to do in the equation world. And it turns out that those things are all really the strengths of agent-based modeling, as you'll know. And so agent-based modeling was what was chosen over these other techniques that you mentioned, and for this particular application. And because of the success that application enjoyed, I would say there was a little bit of a lock-in effect. But there still is system dynamics modeling and discrete event modeling are still used in population health, but not as widely as agent-based modeling.
That is very interesting. So my domain is a thing called operations research, and that came out of a real need in the Second World War for the use of mathematics. And I would say the golden age of operations research has come to an end. I mean, it's lost its way. Do you see, in terms of the future of, you obviously had this great start within ABM, within the public health domain. Do you see that, is there any danger that it's going to wander off and become irrelevant, or do you think there's enough motivation within policymakers to keep it on track?
I think I'm reasonably confident that it's headed in a good direction, although the current moment in history is challenging for many kinds of science. But I would say that there was a dangerous point in the growth of this as a field where it became hugely popular and a lot of resources were being into it. A lot of people were trying to jump on the bandwagon without sufficient training or background in how to do it. And there was a lot of not very high quality work going on in some areas. And that's just a natural growing pain for a field and the adolescence of the field. I think we've gotten past that point to a certain extent where there's better standards that are established, the recognition of what it takes to do this work. So 10 years ago, I would be sitting on a review panel at NIH looking at grant proposals, and proposals would come in that say, oh, yes, we're going to do a 3-year ambitious agent-based modeling project. And none of us on the team have ever done an agent-based model before, but we've included a computer science professor for one summer month a year. And so this is a computer thing, right? So surely that will be fine. And, those sorts of things happened a lot. And I think there's a better appreciation now of what is actually involved in doing good science using this technique. And there's a lot more training available in how to do that. So I feel a little bit more optimistic about that. And on the policy appetite side, there continues to be a sort of high demand from the policy side to use this. And also, I think a side effect of a current pandemic has been that more policymakers are aware of the idea that you could use a simulation model to help think through policy interventions, because that's was very, very big part of how everything was done in the pandemic.
So, it's a beautiful tangent. I'd love to go down there about the potential malicious use of agent-based modeling.
Yes.
But I will defer from that. Maybe it's something we can talk later on.
Okay.
I don't want to put you on the spot, but there is sort of like, but that's actually leads into quite nicely into sort of like, what do you see the future? I mean, where do you see this going? What do you see the future being within ABM, within the public health domain? I mean, is there going to be need for new training courses? Is there going to be what are the needs, and what do you think is going to be achieved?
Yeah, so I think I would sort of roughly group it into 3 interesting areas where there's a lot of activity right now that actually, and my students are all very active in these areas also. So one of them is that there has been a lot of policy success in using agent-based modeling, but it also has brought to light the need for improvement in the technique of agent-based modeling, how we do agent-based modeling, to make it more useful for policymakers. And one of the challenges has been that, we're now in a world where we can use big, fancy, empirically informed models that have lots of agents and lots of realism, and they're being asked to look at real intervention scenarios, and often a very large array of those possibilities. And so we're looking at, essentially searching a huge multidimensional space with a very heavy duty model. And there's real computational and conceptual limits and constraints and bottlenecks there. And so how to overcome those so that you can more quickly get satisfying and rigorous answers to complex questions with a complex model without sacrificing, science is a really interesting technical question. And it's also a practical question about how we, it involves things like how we communicate these to policymakers and what kind of front end we put on them to make them accessible and visualize them, and what kind of back end we put on them to deal with the computational bottlenecks. There's a whole body of work area that I see going on is I would describe the last 15 years as public health saying like, oh, okay, there's this new tool called system science, and it is a valid tool that belongs in our toolbox alongside the existing tools that we know, randomized control trials and regression, or things like this. But what's now happening, which is necessary and in some ways more exciting, is saying like, hey, could we actually use these things together in a meaningful and satisfying way? And so I have a paper that just came out earlier this year that's about the partnership between randomized trials and agent-based models in particular, and how you could actually use them together iteratively and synergistically. And randomized controlled trials are like the tool, the gold standard, not just in public health, but in medicine. Being able to use them with agent-based models to make each stronger and better is, I find, very compelling. And there's other work on using agent-based models with other kinds of experiments, using agent-based models with regression models, all those sorts of things. So that's a second area. And then the third area is that I would say that a door that agent-based modeling's entry into the mainstream of public health has opened is because in an agent-based model, you can assume anything you want about the motivations and mechanisms that drive human behavior. It's raised the question of like, well, what then should we assume about how people make decisions, do risk appraisals, communicate to each other in ways that affect health? And, there are these paradigms that have been around forever, rational choice, theory and bounded rationality and all these things. But they don't actually have a lot of empirical support, and they existed mostly for modeling convenience. And now we don't have to assume them anymore. But then it's kind of scary to decide what we should assume, because it's not clear what to put in there instead. And so a lot of my work and my colleagues' work over the last couple of years has been about trying to figure out what actually goes in there and how to represent it in an agent-based model. And I think there's just a really exciting potential there.
I absolutely agree. I think the behavioral modeling side is the new frontier that we're facing. And it's going to be a new frontier that we'll be facing for probably our careers at least. Right?
Oh, for sure. But I mean, I think what's interesting is that there look like there are developments in other fields of science that are talking to each other, that can be brought into that agent-based modeling can be a way to connect up these different discoveries into a way where they can work together and actually cross fertilize. So that's where a lot of my emphasis has been in my public health work. And a nice thing about public health is that it has always been an inherently interdisciplinary field, so it's a nice application case study to do some of these deeper methodological tasks, in my experience.
Absolutely. Cool. So I'm going to be polite to the audience now. I do have some other questions which I can ask you, but I think the audience have been always polite and not interrupted us at all during our little discussion. So my suggestion now is that if there are any questions that anybody wants to ask, go ahead. I've got questions I can continue with, but please go ahead, Tim. And I'm Matt.
Yeah. Oh, yeah. Matt had a hand up first.
Wow.
Oh, go ahead. First started talking. Okay, I got the floor, I guess. All right. So, hey, I'll start with just practical, very, very practical thing. I'm always interested to hear from people that I haven't talked to in a while about what tools you're using these days. I've been amazed at the longevity of net logo, how long it has remained relevant. It still seems relevant. It's good for certain kinds of things. There's a whole other discussion about that. There are also some cool new tools. There's some legacy tools. What do you use? What do your students use?
Yeah, so I continue to use NetLogo for teaching, and we often are using it for prototyping things or for sort of building things that can engage with stakeholders in the design phase and be sort of more transparent. Then for a long time, when we go to sort of more heavy duty things that have more computational efficiency, I was used to using Repast and Java-based, platforms of various kinds. But the kids today are all Python. It's all Python. So there's many Python agent-based modeling platforms, and that's what almost all of my team's code base is currently in. There are murmurings that one should look at things like Julia, and that might be. I after my tools suit them. I would say an area that there's active in my world about is sort of when is it appropriate. When is it better to have an object-oriented treatment of an agent-based model, and when is it better to vectorize it? And there's trade-offs about speed and conceptual clarity and fidelity to the mental model and a bunch of other things to get into there. But that's an area where there's lots of back and forthing.
Cool. Thanks.
And then the other thing I would say is that there's a whole bunch of packages, some of which my students have written, that are in Python, that are designed to work with agent-based models to help do things like sensitivity analysis and searching of large policy spaces and things like this. And they're all in Python because so much of the agent-based modeling that I see going on is in Python.
It definitely seems like the future. I've been slow to get dragged into it, but even I'm getting dragged into it at this point.
Yeah.
I like Python, and it's great doing as a dabbler who does statistics sometimes and data visualization sometimes and agent-based modeling sometimes to not have to remember how do I do an if then in this language.
Yes.
Like, just always be working the same syntax. It's nice.
Yep.
Yeah, Eva, I was just reading this morning that they over 20 years they've changed all their code from C++ to Python now in the new version. Yes, I avoid it like the plague, so I'm a little bit disappointed. Matt, you're up next if you wanted to ask a question. Then Jacob, if that's okay.
I just wanted to pull the thread a little bit. You brought up, I think, something that's really fascinating. So I've spent a lot of my career in the national security side of things rather than the public health side of things. And agent-based modeling was more ground up in its adoption in the national security space, at least from my experience. And that meant that it actually has been very difficult to get it into that space, get it accepted, get it used, and that kind of thing. So it's fascinating to hear this top-down kind of system that happened in public health, where agent-based modeling was sort of blessed off on from above first. And then you also made the comment about the inherent multidisciplinarity of public health, which I hadn't thought about either, which is also fascinating. And so I'm just curious, do you think, was it those two features that have created this environment for the adoption of agent-based modeling that I see anyway is fairly unique in public health and less so in other domains? Are those the two key factors?
I think you put your finger on two of the key factors for sure. I might add a third, which was it cuts both ways, right? It was a stumbling block also, but in the end, it proved to be an advantage over something like economics, I think, or political science, that there was no existing dominant mathematical theory or set of modeling techniques. So, I mean, I still have the job title of economist at Brookings, and the battles inside economics about closed form equation-based general equilibrium models versus agent-based models are still going on after like 30 years. There's an entrenched, established way of doing things that agent-based modeling is trying to upset. And in public health, the tools that are dominant are not modeling tools. And so modeling of any sort is a new thing, and it's easier to cast it as complementary rather than competitive with the standard way of doing things, if you see what I mean.
Yeah, no, that makes a lot of sense too. Fascinating. Okay, thank you.
Thanks, Jacob. You're up.
Okay, great. I've got a few questions, but I'll start with one and then I'll come back around, I guess. Thanks for the talk. Very interesting to hear about agent-based modeling in public health from someone not in our group, because there's people in our group doing it as well. I work for NetLogo. And so I'm curious to ask a little more about the tools.
Sure.
We're about to come out with NetLogo 7, which has a big upgrade to the look and feel. We're also starting like a new NetLogo Center to make sure it stays long term, because Uri Walensky, who originally made it, is not that far away from retirement, probably, but he recently turned 70. So I'm curious on the performance side. So two questions. One is, are there other reasons besides performance that you don't use NetLogo for bigger projects? And then my other question is on the performance itself, because there's a package called Agents JL that did a performance comparison recently. And NetLogo and Mesa were actually pretty similar in terms of time performance. So yeah, I'm just curious to hear about like what are the big things NetLogo can't do that make you shift to other tools for higher performance things.
Yeah, so I mean, to get too deep into a technical discussion of that, I'd want to talk to we could have a separate offline discussion where I talk to the people who actually are implementing the code for my projects, which I don't really do myself anymore at this point in my career. But I mean, I think at a broad level, there has been a perception, which I'm always open to revisiting if it's not true anymore, that if you wanted too large a number of agents, too complicated an agent description, or too heavy a spatial representation, that it became that there was a performance limit with NetLogo that could be overcome in other more general purpose programming languages. So that may or may not be true anymore, and if it's not, I'd love to hear it. A second thing that I have found, and I use NetLogo a lot, all the time for teaching and training and for building prototypes, is that as you're thinking about designing a model, there are certain choices about how to structure your geography, your spatial structure, and how to structure an agent that NetLogo suggests to you, that are like defaults or that are just easier in NetLogo. Like, for example, it comes up with a lattice by default, in the black box or the green box there, and lattices are very common for certain kinds of agent-based models, but they're not always the right choice. And there's a sense that when you're building a NetLogo model, that it's set up pushes you in certain design directions, and so it's less of a blank slate than if you're starting with just an empty Python program.
Cool, thank you.
And that's a good thing in some ways, because it makes it easier to get something off the ground quickly. But it can also sometimes be detrimental to having a wide initial cast around for what the right formalism is going to be.
Yeah, that makes sense. Thanks.
But to be clear, though, I love NetLogo, and we do use it quite a bit, not just for teaching, but for actual science in my team. So
yeah, we all love NetLogo.
We're trying to make it even more lovable.
Hopefully Ross is still there. Tim's got his hand up, and then we can come back to you, Jacob, so we can alternate between the two, if that's okay. Oh, Tim, you're muted.
All right. And I can even lower my hand. Good. Okay, so now, next thing I'm curious about, this is a favorite topic of mine. It seems to me that in agent-based models, there is an uncanny valley. There are things like the Schelling neighborhood segregation model, very simple toy models that illustrate a principle that is a powerful principle. The principle scales, but there's no need for millions of agents to show the principle. You can do it with hundreds of agents, dozens of agents. And then there are really applied models that are often, full scale with very rich behavior, which maybe even have some kind of predictive element, or maybe not exactly predictive, but you really start to understand the magnitude of things. And that there's a lot of trouble in between. If you start trying to make one part detailed, but you leave another part abstract, you gotta. I remember in NetLogo doing one where I had I constructed a contact network from cell phone data in the pandemic, pre and post lockdown, and we had a 1.3 million agents. So we did a repass model, but actually did a reduced form of that with 1.3 million agents in NetLogo. That worked pretty good, and you got all these interesting dynamics just from the network structure. So the interaction structure was super simple. Sorry, the behavior was super simple. The disease dynamics were simple. The human behavior was simple, but the network was complex. That was actually interesting. But what do you make of this idea that you either need to be simple or complex, and the space in between is an ugly space?
Yeah, I think that's a useful way of looking at it. The form that the middle space has taken in public health, which I actually think has turned out to be quite fruitful, is rather than saying, okay, either all these design elements like the number of agents and how complex an agent is, and how many and what the network structure is, they're either simple and it's a thought experiment, or they're the in-between space that public health has found is that you're actually going to consider maybe 7 or 8 different hypotheses about what mechanism or mechanisms is most important in driving a phenomenon. And so each of them will be represented with relatively simple agents in a relatively small number in a relatively simple environment. So each of them is like one of those Schelling thought experiment models, maybe slightly more sophisticated than that. But there's actually like 7 of them. And you can turn on or off any of them, and they interact with each other when more than one is on. And so then there's actually quite a lot of complexity there, but it's a different axis of complexity than the ones you identified.
Right.
It's like a conceptual complexity. And that turns out to be really important because most health problems have complex origins that do not involve one single mechanism at one single level. It's hard to name one that, I guess, having lung cancer from smoking a lot of cigarettes is probably pretty straightforward. But most of them have pretty complicated epigenesis. And therefore, you need a model like this to untangle, such as I'm describing, to untangle what's really going on and where the levers for action actually are.
Nice.
Yeah, good question.
I think, Jacob, you said you had multiple questions. Did you want to jump back in now?
Sure, yeah. So I'm curious to hear your thoughts. You said how there was an issue at one point where like everybody's getting agent-based modeling and there's a lot of stuff. And I read a blog post a while back, I forget from who, saying the same thing in economics. He thought there were many reasons agent-based modeling hasn't gotten more popular in economics, but one of the reasons he thought was it's so easy to throw together a simple model in NetLogo that there was just like a flood of low quality stuff, and then people said like, oh, this isn't serious. So you talked about standards. I'm curious if you have any other ideas of either improving the standards or like requiring tests of the model, or any other ideas you have that could help improve the quality of published agent-based models.
Yeah. So I think standards are important, and I've written a couple best practices papers, and then I teamed up with a bunch of other reasonably well-known modelers, actually, including some people who do system dynamics and other kinds of models, to actually get a formal consensus best practice document that we all put together and agreed on, posted at NIH and the director's office at NIH. And so anyone who wants to do a system science model in public health, if you're a reviewer of a grant or a journal article, you can go look at this document and say, hey, is this model doing these things? And that's very effective. And partly it's effective in public health because until recently, most public health was driven by funding from the NIH and other, science funders. And there are gatekeepers there about how you get your grant approved with review committees, and they all have litmus tests that they apply to decide whether things make sense or not. And so those standards are very effective at actually shaping what direction things head. And another thing that I have found useful is actually I've encouraged several of my students and team members to take the extra steps you've set up to actually get verified models included in your NetLogo library. And as you'll be aware, there's a bunch of extra stuff you have to do that. And actually that's been useful as a way to say this is a legitimate thing that has been well documented, that's following some basic standards, and that is included as a representative model in the library. And imagine expanding that to have more field specificity and more of a sort of user community flavor as well as a library. And those are some things that are off the top of my head. And then the final thing I would say is that training is essential, and a thing that I and many others have really drilled on in public health is this idea that you don't expect to send someone into you don't hand someone an MD diploma and then just turn them loose operating on people. You do, a residency, and you do supervised training, and there's like this whole path to becoming a practicing physician. And similarly, we need to train people not just in how to program and how to use agent-based modeling tools, but in how to be successful practitioners of this science. And that takes more than just taking a class in it. And how to do that and what that looks like has been something that many people are working on in public health. I think other fields would benefit from also.
Cool. Thank you.
Cool. That's brilliant. I've actually got a follow-on question down. Hopefully no one else is jumping in there. So one of the things that me and Matt are very interested in is this idea of the clustering of communities within the agent-based modeling simulation world, right? I mean, you talk about these best practices standards from a health or public health point of view. Is there much in what you wrote there? Do you feel like this is something that could be applicable across the domain? Is there, are there pieces that could be generalizable? I mean, and could you talk about that just briefly, if you don't mind?
Sure. So I think that's true in two different ways. One of them is a lot of what's going on to make agent-based modeling as useful as possible in public health is really methodological development in the technique of how you do agent-based modeling itself. That it doesn't have to just be for public health. That's widely applicable in any kind of use of agent-based modeling. The second is that a lot of public health is actually social science models that aren't immediately about health as the outcome, because there's this whole idea of social determinants of health. And so a lot of health models actually are about housing, or they're about crime, or they're about taxation, or they're about the retail environment. They're about things or they're about opinion dynamics. And these are all things that have huge applicability outside of public health because they're really in the space of other fields. And that's partly what I meant when I said public health is very interdisciplinary, is that it's actually political science and psychology and economics and sociology and a whole bunch of other things at the same time.
Excellent. Okay, thank you. That's very interesting. I'm definitely going to be looking this up, because I'm very interested in standards and verification and validation. So
I mean, just as a specific case example, like there are lots of people working on misinformation and vaccine refusal or hesitancy, and that's a huge problem in public health. But those models are really about misinformation and disinformation and how people form beliefs and how social networks play a role in that. That doesn't have to be about, I mean, vaccines is one topic, but it could be about lots of things that are outside the domain of health too.
Okay. So I've got loads of questions, but I'm going to be a good boy. I think we can. Has anybody got any further questions? Otherwise, we're going to wrap up this session.
I'll ask one more.
Okay, go for it, Jacob.
You have to ask an AI question these days.
Yeah.
So I'm curious. I've seen a couple papers now on using large language models as the agent behavior component of an agent-based model to try to get like more flexible agent behavior. And I've seen at least one that was specifically in epidemiology. I haven't looked deeply enough into it yet to have a strong opinion, but I'm curious if you've looked into it, what your thoughts are, and just sort of generally what the conversation is in public health about AI tools and how they may or may not impact this type of modeling.
Yeah, that's a huge deep rabbit hole that we probably don't have time to do justice to in the last couple of minutes here. But I guess I would say that I think there is a role for AI to be helpful in how you apply agent-based models and use them. I am more skeptical about AI as a core element of the models themselves in their design or conceptual underpinnings. But I think there's a big conversation there and lots back and forth.
Are you still with us, Ross? You've just started to, well, you just cut out there for that last part of that sentence there.
Oh, okay. Yeah, that's okay. I probably have to go in a couple minutes. I'm starting to lose connectivity here.
Yeah. All right. Well, in that case, I think on that the note, let's all thank Ross. I really appreciate this. It's been super interesting. I've at least now know the difference between public health and healthcare. So thank you. So appreciate it.